So hello everyone. Hello everyone. This is Dr. Priyankita Nath, your faculty for the anatomy, and I am going to start a rapid revision series. Today's topic is neuroanatomy in a nutshell. So I want everyone to follow through the entire session because neuroanatomy is complicated, as you know. So I want you to make the neuroanatomy very easy. Okay, you will feel like it's nothing. You understand one by one the topics. So we are going to start with the series. Let us start then. Okay. So we are going to mostly start the neuroanatomy from the outside to the inside. All right. Like from the cranium, then through the meninges, then dural venous sinuses, and then we'll go through the brain. So बाहर से अंदर तक हम लोग पढ़ेंगे systematically. So let us start the cranium. Okay. So the first question which has been repeated twice. Okay. That is, identify the encircle structure. So, okay, can you see the structure? Okay, this encircle structure. So they have asked you to identify this. So anybody in the chat who can identify without getting into that? What is this? They have given the option Terion, Asterion, Nasian and Bregma. Okay, so anybody knows what is it? Anybody in the chat who knows the answer? So before we start this, let us study about one by one what is Terion, what is Asterion, Bregma and all. Okay. So Terion, as you know, it is a H-shaped bony landmark. Okay. If you can see here in this image, okay, it is a H-shaped bony landmark. Okay, H-shape. The shape is like H. Okay, and it is at a junction of your. This is the frontal bone. This is the frontal bone. Okay, then this red color is the greater wing of sphenoid. Okay, then you have the parietal bone. This is the parietal bone and the squamous part of temporal bone. So it is formed at the junction of these bones. Okay, so it is formed at a junction of this bone. And what is the significance of this point, Terion? Okay, so इसमें क्या होता है? You have a artery. Okay, that artery is the middle meningeal artery. ठीक है? You have the artery, that is the middle meningeal artery. Let me show it a different color. So you have this artery, that is the anterior division of middle meningeal artery underneath this terion. Okay, underneath this H-shaped landmark, you have this artery. And what happens? This is the weakest point of your skull. So any traumatic blow to it will rupture this artery. And if there is a rupture of this artery, you will have your epidural hematoma. ठीक है, तुम लोग का क्या होगा? Epidural hematoma. So terion, just remember P. ये P को तुम H बना दो, ठीक है? Just remember that P is becoming the H. And what are the bones? You have the frontal bone, the parietal, the greater window sphenoid, and the temporal bone. So if you want to attempt this answer, as you can see in this image, you can see this is the frontal bone. Let me show it a different pen color. Okay, so this is the frontal bone. This is the frontal bone. ठीक है, ये है parietal. Okay, and then this is the squamous part of the temporal, and this is the greater wing of sphenoid. ठीक है, this is the greater wing of sphenoid. तो ये क्या होगा? This is the terion, and it has a significance that the middle meningeal artery will be below this terion. ठीक है, the middle meningeal artery will be below this, so any blow to this region will lead to your rupture of this artery, and इसका rupture से क्या होगा? You will have your epidural hematoma. All right. Okay. So let us attempt the next one, that is the middle meningeal artery is a branch of. अभी next question जो है इसका change हो गया है. So they have asked you the middle meningeal artery. Already we got the significance in the terion. ठीक है, तो middle meningeal artery में तुम्हारा rupture हो जाएगा, it will do the epidural hematoma. अभी ये middle meningeal artery किसका branch है? So they have given the option maxillary, mandibular, facial and ophthalmic artery. Now to understand that, okay, you have to know the branches of the artery. Okay, so you can see here that middle meningeal artery, it is a branch coming from the maxillary artery. Now maxillary artery का बहुत सारा branches है. ठीक है, so before lateral pterygoid it has 5 branches, then lateral or within the pterygoid it has 4 to 5 branches, and then beyond it has again 5 to 6 branches, but we are morely concerned with the middle meningeal artery. Okay, middle meningeal artery. So this artery is a branch of your maxillary artery. Okay, it is a branch of your maxillary artery. तो इसका आंसर होगा तुम्हारा, what is the correct answer for this? This will be the maxillary artery. Okay. Next, another question. So you got 3 questions repeatedly. Okay, you have the terion जैसा 3 question they have given simultaneously in many sessions. So another question for you is that same type they have mentioned that a patient suffered from the extradural hemorrhage. Okay, they suffered from the extradural hemorrhage due to the involvement of middle meningeal artery. So you know that this artery is present below terion. So what is the location? The location is your terion. Okay, this is the correct answer. Okay. Now let us come to another point, that is the ब्रैग्मा. अभी ये ब्रैग्मा क्या है? हमने पढ़ा टेरियन, उसके बाद था एस्टेरियन. नाउ व्हाट इज दिस ब्रैग्मा? नाउ ब्रैग्मा जो है वो एंटीरियर फॉन्टेनली ही है. ठीक है, इट इज़ द एंटीरियर फॉन्टेनली ओनली, बट इन एडल्ट्स इट इज़ कॉल्ड ब्रैग्मा बिकॉज दिस एंटीरियर फॉन्टेनली ऑक्सीफाइज. So in children's, in the newborns, you can see a depressed area on the skull, which is a diamond shaped unossified region. Okay, this area is your the anterior fontanelle, and when it ossifies it is called the bregma. So it is at a junction of, you can see this is the frontal bone, and then you have the parietal bone. Okay, you have the frontal bone and the parietal bone. So it is at the junction of your 2 sutures. So you have a coronal suture and a sagittal suture. ठीक है, तो 2 suture के बीच में एक point है, that is called your bregma, and it is also known as anterior fontanelle in infancy. And what is the age of ossification? So it is 18 months. Okay, it is 18 months of life. So bregma जब तुम्हारा anterior fontanelle it will ossify, okay, at the time of 18 months, then it becomes a bregma. Now this is the anterior fontanelle is the largest of the 6 fontanelles. ठीक है, सबसे बड़ा है, सबसे largest है, and delayed closure may occur in certain condition like increased ICP, hypothyroidism and skeletal abnormalities. और जो premature closure है उसको हम बोलते हैं craniosynostosis. So any question might come from the bregma. ठीक है, craniosynostosis में भी आ सकता है question. Okay, so you might get a question on any of the part. Okay, so you might get a question on any of the part on bregma. ठीक है, So हमने पढ़ लिया है टेरियन डेंड्रैगमा. Now we are going to your a question. So anterior fontanelle, okay, anterior fontanelle correspond to all except, okay, they have given an exception. So they have given the frontal bone, the coronal suture, the again you have given the lambdoid suture. Okay, you have three parts: the frontal bone, the coronal suture, and the lambdoid suture. So you know that frontal bone yes, coronal suture yes. So the correct answer will be your lambdoid suture, because lambdoid suture is present in the back, right? It is not related to anterior fontanelle. So the correct answer will be lambdoid suture. ठीक है? Yes. देखो सबने correct answer ही दिया है. Very nice. Okay. Now let us come to asterion. ठीक है? Asterion. Okay. Asterion क्या है? What do you mean by asterion? Okay, now this is found on the lateral aspect of the cranium. Okay, it is found on the lateral aspect of the cranium. अभी तुम लोगों को टेरियन कहाँ मिला था? Where did you got the टेरियन? Where did you got the टेरियन? कहाँ मिला था टेरियन? Anybody? Where did you get the टेरियन? टेरियन था H-shaped fontanelle, right? H-shaped fontanelle. Where did you got? It is the junction. टेरियन मिला था हम लोग को इस एरिया में. Okay, we got टेरियन here. And उसी के पीछे we have asterion. So ये याद रखना, A जो है asterion, it is on the back, okay, and P is on the front. ठीक है? P होता है आगे, okay, P on the front, okay, P will be on the front and A will be on the back. तो एस्टेरियन होगा पीछे और आगे क्या होगा? आगे होगा तुम्हारा टेरियन. ठीक है? तो इन दिस इमेज यू कैन सी दिस बैक साइड, दिस इज योर एस्टेरियन ए एंड आगे क्या है? दिस इज योर टेरियन. दिस इज योर एच शेप suture, that is your terion. Now asterion is formed by your, you can see the occipital bone on the back side. This is the occipital bone. Then you have the parietal bone here. ठीक है? And you also have the temporal bone. So it is formed by this three bone and it is located at the junction of your lambdoid, occipitomastoid and parietomastoid. तो इधर में होगा तुम्हारा lambdoid suture. Okay, as you can see here, this is the lambdoid suture. ठीक है? So it represents the close site of mastoid fontanelle और इसको भी हम बोलते हैं posterolateral fontanelle. ठीक है? अभी posterolateral fontanelle जब ossify हो जाएगा उसी को हम लोग बोलेंगे asterion. ओके, उसी को हम बोलेंगे asterion. Anybody has any doubt till now? You can ask in the chat. Any doubt? Okay. Now what is Nazian? हमने पढ़ लिया टेरियन, हमने पढ़ लिया एस्टेरियन. नाउ नेजियन क्या चीज़ है? नेजियन, नाउ लेट मी शो यू हियर. ओके, so Nazian is the anterior part of the frontonasal suture. So in the nose you have this frontonasal suture and it is the anterior part of the frontonasal suture. The Nazian is the anterior part of the frontonasal suture. Okay, now it is a point where the internasal suture, मतलब दो नाक के suture और frontonasal suture converge. ठीक है? तो Nazian होगा तुम्हारा anterior point of the frontonasal suture. What about the glabella? अभी तुम लोग को दिख रहा है, you know that we have eyebrows, right? We have eyebrows. So these are the superciliary arches. If you see in my face, these are the superciliary arches. So the midpoint of the superciliary arches, the midpoint of the superciliary arches is known as your glabella. So glabella है ये. Okay, this is the midpoint of the superciliary arches. Now you know that bindi, हम लोग जहाँ बिंदी लगाते हैं, that is the point of glabella. Okay, so this is your bindi point. Try to remember that. This This is your bindi point. So wherever you put a bindi, no, girls used to put bindi, that is the glabella. Uske niche hai nasion. Okay, so glabella is the midpoint between the two superciliary arches, and nasion is the anteriormost part of the internasal suture. So it is the anteriormost part of the internasal suture. ठीक है. और मिड लाइन में और एक टर्म है, that is known as the gnathian. gnathian क्या है? It is the midpoint at the lower border of the human mandible. So this is the midpoint. This is known as the gnathian. Okay. So it is a midpoint at the lower border of the human mandible. ठीक है. So now you know that सबसे ऊपर where you put the bindi, that is your glabella. उसके नीचे है nasion. उसके नीचे that is your gnathian. Okay. Everybody understood? Okay. Now we have another point, that is the inion. Okay, अभी inion क्या है? अभी पता है on the back side, that is the external occipital protuberance. We have the tip of the external occipital protuberance. As you can see in this image, the tip of the external occipital protuberance, the tip of the external occipital protuberance is known as inion. Okay, so inion is the tip of the external occipital protuberance. ठीक है. What is rhinian? तो हमने पढ़ लिया nasion. अभी rhinian क्या है? What is rhinian? So you know that this is the internasal suture. Internasal suture. Okay. So इसका upper end is known as nasion and the lower end is known as rhinian. Okay. The upper end is known as nasion and the lower end is known as rhinian. So अगर हम लोग ऊपर से नीचे आएंगे तो बिंदी जहाँ लगाते हैं, where we put the bindi, the midpoint of the two superciliary arches, the midpoint of the two superciliary arches, that is the glabella. उसके नीचे we have the nasion, उसके नीचे we have the rhinian, and एकदम नीचे we have gnathian. Okay, so you can see here, this is the nasion and this is the rhinian. Okay, so understood? Any question might come on these points. Okay, asterian, terian, gnathian, rhinian. ठीक है. So पहले आता है bindi point. Wherever you put a bindi, that is the glabella. Just below that you have nasion, then you have rhinian, and then you have gnathian. और पीछे है हमारा inion. Now on the lateral side, you have anteriorly you have the terian and posteriorly you have the asterian. I hope it is clear to everyone. Okay. Similarly, in this image, you can see that is the image clear to everyone? Okay, so you can see that this is the terian, okay, this is the asterian, okay, this is the terian. As you can see, this is the terian, this is the asterian. Can you see the whatever I am pointing? Is it visible? I am pointing with a laser pointer, okay. So this is the terian, this is the asterian. आगे इधर में the bindi point is the glabella. उसके नीचे इधर होगा nasion, then rhinian, और इधर होगा gnathian, और at the extreme back you will have your inion. Okay, you will have the inion. All right. Okay. Now I want to tell you that this is the cranium. Okay, inside that we have the brain. Now in between the cranium, the brain, we have meninges which covers the brain. Okay, you have meninges, and then this cranial vault. If you take a section, and see from above, if you take a section, okay, and see from above, you cut a section here, and if you see from above, okay, then you can just see that you have anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. ठीक है? Okay. Now, as you can see, this is a bone. This is a bone. We have taken a section, and this part is the anterior cranial fossa. This is the middle cranial fossa, and this is the posterior cranial fossa. Okay. I think you have oriented yourself. You have to get oriented with the bone, then only you will understand which are the fossas. Now we are going to study the foraminas in each of the fossa and the structures coming out from those foraminas. Okay, how are the structures coming out from each of those foraminas in the fossa? So क्या क्या foramina है? Now let us concentrate. Okay, let us just concentrate on the anterior cranial fossa, only on the anterior cranial fossa. So this part is the anterior cranial fossa. It is the anterior cranial fossa. ठीक है. Now इसमें क्या क्या structures हमको दिख रहा है. Okay, so you can see what are the bones taking part. Okay, what are the bones taking part. Now you know that these are the orbital plate of your frontal bone. Okay, these are the orbital plate of your frontal bone. I hope the image is clear. Okay, so you can see the orbital plate of the frontal bone. Okay, these are the orbital plate of the frontal bone. Now here you have the ethmoid bone. Okay, the cibriform plate of the ethmoid bone. Okay, this part you will have the cibriform plate of the ethmoid bone. Okay. So you can see that this part is the cibriform plate of the ethmoid bone. Okay, this is the cibriform plate of the ethmoid bone. And then you have the lesser wing of the sphenoid below. Okay, the one which I am showing you the laser, that is the lesser wing of the sphenoid. Okay, is it visible to you? So now what are the foraminas found? What are the foraminas found in the anterior cranial fossa? So you have a small foramina here that is known as the foramen cecum. Okay, you have a small foramina here that is known as the foramen cecum. And then you have small again foraminas here in the cribriform plates. So these are the cribriform foramina. Okay, and these small foraminas, okay, the small foraminas are for the olfactory cells. Okay, you will get olfactory cells from these foraminas. All right. So you have the foramen cecum. Then you in the cibriform plate you have small foraminas, and this piece of bone is known as the crista galli. Anteriorly you will have anterior ethmoidal foramina, and posteriorly you will have posterior ethmoidal foramina. Okay. Now what is important out of all of the structures here is that this foramina, the foramina in the cribriform plate, which are transmitting the axons of the olfactory cells. So you know that olfactory nerve is cranial nerve number 1. Okay, it is cranial nerve number 1. So the cranial nerve number 1 will pass through this cibriform foraminas in the cibriform plate. Okay, so the first cranial nerve is passing through the cibriform foraminas in the cibriform plate of ethmoid. ठीक है, so anterior cranial fossa में क्या foraminas है, छोटा foraminas है. Those foraminas are your cibriform foraminas through which the olfactory nerves are passing. Okay, so cranial number 1 कहाँ से pass होता है? That is through the cibriform foraminas. Now you understood that? Okay, now we are going to study about a middle cranial fossa. अभी middle cranial fossa में बहुत सारा foraminas है. Okay, you have many foraminas. So let us study one by one. Okay, now first is this foramen that is known as the optic canal. Okay, optic canal. Okay, optic canal will transmit your optic nerve, and optic nerve is your cranial nerve number 2. ठीक है, optic nerve is your cranial nerve number 2. So after the anterior cranial fossa, in the middle cranial fossa, we have first foramen, that is the optic canal, and this optic canal is going to transmit your cranial nerve number 2. Okay, then you have a foramina here that is known as the superior orbital fissure. The superior orbital fissure. Now, superior orbital fissure is going to transmit your cranial nerve number 3, 4, V1. V1 matlab trigeminal ka first branch, that is ophthalmic branch, and 6, that is abducens. Okay. So till now we have studied that through the optic canal, what is going to get transmitted? That is cranial nerve number 2, and through the superior orbital fissure you have cranial nerve number 3, 4, V1 and 6. Okay. Now you have 3 structures lying from above downward in the mnemonics R, O, S. So R is the foramen rotundum, O is the foramen oval, and the small foramen is the foramen spinosum. Okay, everybody clear? Anybody has doubt in this? Anybody has doubt in the foramens? So you have 3 foramens, that is R, O, S. So R for rotundum, foramen rotundum. So you have this foramen here, rotundum. Then you have an oval foramen, that is foramen oval. Okay, and then you have a small foramen here, that is the foramen spinosum. Okay, that is the mnemonics, whatever foramens you have. Okay, so R, O, S, R, O, S, rotundum, oval and spinosum. Now through the rotundum, what nerve is going to get transmitted? That is the V2. Now what is V2? V2 is the maxillary nerve. V2 is the maxillary nerve. Okay, V2 is the maxillary nerve. Through the oval, what nerve is going to get transmitted? That is V3. That is the mandibular nerve. And through a spinosum, a recurrent branch from the mandibular nerve will go, that is known as nervus spinosus. It will go in the opposite direction. Okay, a recurrent branch from the V3 will pass through the foramen spinosum, that is known as the nervus spinosus. Okay, so till now what structures we have studied? First of all, we got the optic canal. Optic canal is going to transmit the optic nerve. Then we got the superior orbital fissure, which is going to transmit your 3, 4, 5, that is V1 and 6. Okay, and then you have ROS. In R you have rotundum, you have V2. In oval you have V3, and in spinosum you have recurrent branch of V3. Okay, so till now we got that all these foramens. Then we have another foramen, that is foramen lacerum, whose borders are lacerated. Okay, foramen lacerum. And then you also have a hiatus for the greater pectoral nerve. Okay. Okay, so these are the foramens. In the petrous part you have another foramen here. What is that foramen known as? Anybody? What is that foramen known as in the petrous part of the temporal bone? What is this foramen known as? This is known as the internal acoustic meatus. Like you have an external acoustic meatus, you have an internal acoustic meatus, which will transmit your cranial nerve number 7 and 8. Okay, it is going to transmit your cranial nerve number 7 and 8. So these are the foramens in the middle cranial fossa. So first of all, we got the optic canal, which transmit your number 2. Then you got the superior orbital fissure, which has 3, 4, V1 and 6. Then ROS, remember ROS, that is rotundum, oval and spinosum. Rotundum has V2, oval has V3 and spinosum has recurrent branch of V3. That is, what is V3? That is the maxillary nerve. And then you have the internal acoustic meatus, which will transmit your 7 and 8 cranial nerves. Okay, now we have a mnemonic for the foramen oval. You have a mnemonic for the foramen oval. So you can see that the mnemonic is MALE, male. Okay, the mnemonic for foramen oval is male. ठीक है? M for the mandibular nerve, as discussed, the V3 will go through the foramen oval. A for the accessory meningeal artery, L for the lesser petrosal nerve, and E for the emissary vein. So you try to remember this is a very hot mnemonic for foramen oval, that is MALE. So M, you know that V3 goes through the foramen oval, A for accessory meningeal artery, L for lesser petrosal nerve, and E for emissary vein. You have to remember this mnemonic because many questions is to come on the contents of the foramen oval. Now tell me this, which structure is not transmitted by foramen oval? The question is not transmitted. So they have given the option middle meningeal artery, accessory meningeal artery, emissary vein, and lesser petrosal nerve. Anyone? In the chat box, I want a quick answer. Just now we have studied about a mnemonics MALE, male. So which of the structure is not transmitted by the foramen oval? Anyone? I'm waiting. I want an answer, quick answer from. It's a very easy question, repeated many times in the exam. Anybody who wants to answer this in the chat? Anybody who wants to answer this? It's so easy question. Just now we have studied about the male mnemonics. So उधर में से कौन सा इधर का नहीं है? Anyone? Come on, somebody should attempt this. Okay, so nobody is attempting this very easy one. So what is this answer? The answer is your middle meningeal artery. Middle meningeal artery is not a contain of foramen oval. You know that it is mandibular nerve. Okay, out of the male structure, it is mandibular nerve. Mandibular nerve. Okay, you have the mandibular nerve. Okay, so that is V3. Okay, out of the male structure, it is the mandibular nerve. It is not the middle meningeal artery. So they have asked which structure is not transmitted. It is not transmitted through the foramen oval. So it is the mandibular nerve. Okay. Okay. Now maxillary nerve is transmitted via, somebody should attempt this. Okay, maxillary nerve is transmitted via, they have given foramen oval, foramen rotundum, foramen spinosum, and superior orbital fissure. So anybody who wants to attempt this maxillary nerve, just think about it for 5 seconds and just attempt it. Anybody from in the chart? Maxillary nerve is transmitted via which of the following? It's very easy. Just think about it. Maxillary nerve. Maxillary nerve क्या है? It is V2. V2 is transmitted via which of the following foramens? V2 is transmitted, that is maxillary nerve is transmitted via, it is a second branch, right? It is a second branch of your trigeminal. So it is transmitted via which of the foramen, following foramen? Anybody in the chat? This is very easy answer, okay? So it is transmitted via foramen rotundum. You have studied about ROS. Okay, so ROS, ROS, and rotundum से क्या जाता है? That is your V2. We have studied V2. Oval से you have the V3, and spinosum से you have the recurrent branch of V3. So the answer here is foramen rotundum. ठीक है? So till now, what are the structures we have studied? So we know that the first cranial nerve is passing through the foramina, cribriform foraminas, okay, in the cribriform plate of ethmoid. Okay. The second cranial nerve is passing through the optic canal. It is passing through the optic canal. Okay. Then the third, fourth, V1, that is the ophthalmic division, and sixth, okay, those are passing through the superior orbital fissure. Okay, then you have a structure that is ROS. Okay, ROS. So through the R, that is rotundum, the maxillary nerve is passing, through the oval, the mandibular nerve is passing, and through the foramen spinosum, the recurrent branch of your V3 mandibular nerve is passing. Okay? I hope it is clear. And through the internal acoustic meatus, we have the facial nerve and the auditory nerve, the vestibulocochlear nerve. Okay? So the 7th and 8th nerve is passing through the internal acoustic meatus. Now, there is something about the superior orbital fissure. Okay? Now this superior orbital fissure, this entire fissure is divided into 3 parts. Okay, it is divided into 3 parts, by a tendinous ring, and this tendinous ring is known as annulus of Zinn. Okay, it is known as annulus of Zinn. Okay, there is a tendinous ring which is dividing the superior orbital fissure into 3 parts. Okay, that tendinous ring is known as the annulus of Zinn, which is giving rise to your extraocular muscles. Okay, now among the 3 parts, the first part, that is the superolateral compartment, if you can see the upper part, the superolateral compartment, okay, the superolateral compartment will give the following structure in the mnemonics LFT. Okay, you have the mnemonics, that is the LFT. Now what is that mnemonics? What is L for? So you have the lacrimal nerve, okay, the frontal nerve, and the trochlear nerve. Okay, and you have a vein, that is the superior ophthalmic vein. Okay, that is from the superolateral compartment. Okay, you have from the superolateral compartment. Okay, now from the intermediate compartment you have BOAN, B-O-A-N. That is, you have both the division of oculomotor, the abducens, and the nasociliary nerve. Alright, and from the inferomedial compartment, that is below, from below the inferomedial compartment, you have the IIPZ. Okay, IIPZ, that is your inferior ophthalmic vein, the infraorbital nerves and vessels, the rami of the pterygoid ganglion, and the zygomatic branch of the maxillary nerve. So this is a mnemonics for the contents of the superior orbital fissure. As you can see here, okay, as you can see here in this image. So you have the LFT, that is the lacrimal nerve, the frontal nerve, and the trochlear nerve in the superolateral compartment. In the intermediate compartment, you have both the divisions of oculomotor. Okay, you have both the divisions of oculomotor, and you have the abducens nerve and the nasociliary nerve. Okay, and in the inferolateral compartment, you have the inferior ophthalmic vein and the infraorbital nerves and vessels. Okay, you have the infraorbital nerves and vessels. Okay, so these are the contents and the mnemonics for the superior orbital fissure. Why I am teaching you this is that there are many questions on the superior orbital fissures. Okay, so you get many repeated questions on the superior orbital fissure. Okay, so one of the question is that I want someone to attempt this. Which cranial nerve is not transmitted by foramen ovale. ओके पहले ये अटेम्प्ट करो, कौन सा cranial nerve is not transmitted by foramen ovale? So they have given 2, 4, 3 and 5. Through foramen ovale, which cranial nerve is not transmitted? So I want an answer for this from the chat. Through the foramen ovale, कौन सा nerve pass नहीं होता है of all of the following? I want you to answer at the last session of this slide. Okay. ये सोच लो क्या है. Okay. The next question is, which of the following passes through the lateral part of the superior orbital fissure? They have mentioned the word superolateral part. Okay, they have mentioned the superolateral part. Okay, which of the following passes through the superolateral part of the superior orbital fissure? So anybody who wants to answer this? सुपेरोलैटरल पार्ट से कौन सा स्ट्रक्चर पास होता है? आउट ऑफ ऑल दिस दे हैव गिवन सुपीरियर ऑप्थेल्मिक वेन, द inferior ophthalmic vein, the nasociliary and the abducens. Anybody who wants to answer this? I need an answer from in the chat box. Anyone wants to attempt to answer this? Just now we have studied about the superolateral compartment. Okay, we have studied about a superolateral compartment. So which of the following passes through the lateral part of the superior orbital fissure, that is a superolateral compartment? Which of the following? Anybody in the chat box who wants to answer this? Come on, somebody should attempt this. It is very easy. Just now we have studied about the contents of the superior orbital fissure and the mnemonics for the superior orbital fissure. So anyone who wants to attempt this question? No one? What will be the answer for this? Okay, the answer will be as easy as that. That is a superior ophthalmic vein. So we have the LFT and the superior ophthalmic vein, right? LFT and the superior ophthalmic vein. The superior ophthalmic vein. तो ये है content. So the answer will be the superior ophthalmic vein. ठीक है? So this came in one of the FMG questions. Okay. Okay. Now, which of the following passes through the inferior orbital fissure? So, someone should answer this. Through the inferior orbital fissure. तो अभी हम लोग ने superior orbital fissure पढ़ा है, inferior orbital fissure भी पढ़ा है. We had a mnemonic for the inferior orbital fissure also. So, which of the following passes through the inferior orbital fissure? They have given infraorbital artery, infraorbital nerve, both or none. So, anybody who wants to answer this? Which of the following passes through the inferior orbital fissure? Somebody from the chat who wants to answer this? No one? Come on, somebody should attempt this. It's very easy. Just now we have studied. Which of the following passes through the inferior orbital fissure? Okay, so the answer for this is your both. Okay, it is both the infraorbital artery and infraorbital nerve. Okay, so we have studied about IIPZ. Okay, in the mnemonics, as you can see here, you have seen here that it includes both the infraorbital nerves and vessels. Then you have the rami of pterygoid ganglion and a zygomatic branch of the maxillary nerve, along with the inferior ophthalmic vein. So they have given both the option, the infraorbital nerve and artery. So the answer is infraorbital nerve and artery. That will be the both. Okay. So this answer will be your both. Okay, that will be the C. Okay. Next, let us come to the posterior cranial fossa. Okay, the posterior cranial fossa. So in the posterior cranial fossa, as you can see, you have a big foramen here, that is the foramen magnum. Okay, you will have a big foramen, that is the foramen magnum. Okay, and on the side you will have a small foramen, that is the hypoglossal canal, if you are coming from the back side. And this area, this big foramen, this is the jugular foramen. Okay, this is the jugular foramen. So you can see this area, this is the jugular foramen. So this jugular foramen is again divided into three parts. Okay, it has three parts in the jugular foramen. So what are those parts? So if you can see that on the medial aspect, okay, see, this is the jugular foramen. If you see on the medial aspect, you can see a sinus here, and this sinus is your inferior petrosal sinus. Okay, this is the inferior petrosal sinus. So this is the inferior petrosal sinus on the medial most part. Then you have a cavity here, and in this cavity you have the 9, 10 and 11 nerves. Okay, you have the 9, 10 and 11 nerves. ठीक है, ये जो nerve है, that is your glossopharyngeal, the vagus and the accessory nerve. And on the lateral most aspect, you have the junction of the sigmoid sinus with the jugular vein. So on the lateral most aspect, there will be the junction of the sigmoid sinus with the jugular vein. Okay, so you have three parts in the jugular foramen. Okay, so you on the lateral aspect you will get the jugular vein. Okay, the jugular vein, which will the junction of the sigmoid sinus with the jugular vein. Okay, in the middle cavity you will have the 9, 10, 11 nerve, the 9, 10, 11 nerves. Okay, the 9, 10, 11 nerves in the middle compartment. And the medial most compartment, you have a sinus again, that is the inferior petrosal sinus. So you will have the inferior petrosal sinus. Okay. So these are the three compartment of the jugular foramen. On the medial aspect, you can see sinus, that is the inferior petrosal sinus. This is the inferior petrosal sinus. In the beach ka cavity, you have the 9, 10, 11 nerves, and on the lateral most compartment, the junction of the sigmoid sinus with the jugular vein. So that is about the jugular foramen. And ये सबसे बड़ा जो foramen दिख रहा है, that is a foramen magnum. और इसके साइड में दो छोटा छोटा foramen है, that is the hypoglossal canal. It is not a complete foramen, so you also have the hypoglossal canal. ठीक है? Now through the hypoglossal canal, okay, through the hypoglossal canal, here you will have a hypoglossal canal, the hypoglossal nerve will pass. Okay, the hypoglossal nerve will pass. So 9, 10, 11 will pass through the jugular foramen, the 9, 10, 11 nerve will pass through the jugular foramen, and the 12th nerve will pass through the hypoglossal canal. Okay, the 12th nerve is going to pass through the hypoglossal canal. ठीक है? Now somebody should attempt this question, very easy. Which of the following structures pass through the jugular foramen except, so they have given the jugular vein, the glossopharyngeal nerve, the hypoglossal nerve and the vagus nerve. Come on fast, somebody should answer this. It is very easy. Which of the following is not passing through the jugular foramen? Anybody who can answer this for in 5 seconds? Anyone who wants to attempt this question? It's very easy. Just now we have studied about this jugular foramen. Anyone in the chat box? कोई तो attempt करो, ये बहुत easy question है. अभी हम लोग ने we have seen through the contents of the jugular foramen. So which of the following except? Anyone in the chat box? Which of the following is not passing through the jugular foramen? So the answer to this will be your hypoglossal nerve. The hypoglossal nerve is passing through the hypoglossal canal, not through the jugular foramen. Okay, you have the 10th nerve here, okay, the 9th nerve here, and the jugular vein. The 10th nerve, the 9th nerve, okay, and the jugular vein. So the hypoglossal nerve doesn't passes through the jugular foramen. That is the correct answer. It passes through the hypoglossal canal. Okay, it passes through the hypoglossal canal. Okay. Let us come to the foramen magnum. Now, the foramen magnum, as you can see, the large foramen here, that is divided into two parts. Okay, anterior part is your osteoligamentous and posterior part is your neurovascular. Okay, the anterior part is osteoligamentous, means you will have bone and you will have ligaments, and the posterior part is neurovascular. So in the anterior part, what are the ligaments? You will have the apical ligament of dens, okay, and the superior band of the cruciform ligament and membrana tectoria. Now in the posterior part, which is a larger part, you will have the lower part of the medulla oblongata. Never say spinal cord, okay, spinal cord is not emerging through the this one foramen magnum. So you have to say the lower part of medulla oblongata, okay, the lower part of medulla oblongata along with the meninges are emerging through the foramen magnum. So along with that, you will have the vertebral artery and the sympathetic plexus surrounding the vertebral artery. Then you are also going to have the spinal root of the spinal accessory nerve, the anterior spinal artery, okay, then you will have tonsil of the cerebellum and also the meninges and the dural spaces. So these are the contents of the large foramen, that is foramen magnum. Okay, so the anterior part has mostly the ligament, okay, that is the osteoligamentous, and the posterior part is mostly neurovascular. Okay, that's about the foramen magnum. So let us come to the meninges. Okay, let us come to the meninges. What are the meninges of the brain? So you have the dura mater, okay, and the dura mater is also known as the pachymeninx. Okay, the dura mater is also known as the pachymeninx. Till now everything is clear, I hope. Anybody has any doubt? Okay, so the dura mater is known as the pachymeninx, and the arachnoid and the pia mater together are known as the leptomeninx. Okay, leptomeninges. So dura as a whole, the outermost meninge which is related just after the cranium, you have the dura mater, that is known as the pachymeninx. It is the thickest of the all of the meninges, okay, and then the thinnest is the pia mater, and arachnoid and pia mater are together known as the leptomeninges. So dura is the pachy and arachnoid and pia is the leptomeninges. Okay, now okay, so you know that the brain is covered by the three meninges. So you have the dura, which is the toughest, then middle arachnoid, and the innermost is pia. Now dura mater is derived from mesoderm. Okay, sometimes you might get an MCQ on this. Dura mater is derived from the mesoderm, and hence it is a fibrous, dense fibrous tissue, and it is known as pachymeninx. Now the dura mater will have your outer endosteal and the inner meningeal layer. Okay. Now in certain places it will undergo dural folds. Okay, it will undergo dural folds. Now the arachnoid and the pia mater are arising from your neural crest cells. Okay, they are arising from the neural crest cells. Okay. They are arising from the neural crest cells, and together they are known as the leptomeninges. Okay, together they are known as the leptomeninges. So what are the spaces? What are the spaces? So you know that the extradural space, the extradural, it is outside the dura. The space outside the dura mater is known as the extradural space. Okay, outside the dura mater, the space is known as extradural space. What do you mean by epidural? What do you mean by epidural? Space outside the spinal dura. Okay, this is also outside the spinal dura. This is also outside the spinal dura. Both are same, almost same. Okay, so epidural, extradural. So both are outside the spinal dura. Now, both are same. Okay. Then you have the subdural space. Subdural space is between the dura and the arachnoid. So sub means below, below. So dura के नीचे वाला space is subdural. Dura के ऊपर वाला space is epidural or extradural. ठीक है? What about the subarachnoid space? So first of all, you have the dura mater. Okay, you have the dura mater, then you have the arachnoid, and you have the pia. So the space above the dura is the epidural. The space below the dura is the subdural. Arachnoid and pia के बीच में जो space है, that is known as the subarachnoid space, and the space between the pia and the brain is the subpial space. So this is very important for you to understand which are the spaces, okay? Which are the spaces, because questions used to come on this. Everybody clear on this? Anybody has doubt in the spaces? Okay. Now let me show on this image. As you can see, this is the dura mater, this red one which I have shaded. Okay, this is the dura mater. Okay, this is the dura mater. Now space above the dura is the epidural space. Space below the dura is the subdural space. Just try to remember, epi means above. Extradural or epidural, both are same, and those are the space above the dura, and space below the dura is the subdural space. Now after subdural space, you have a layer that is the arachnoid mater. Arachnoid mater. Now after arachnoid, below the arachnoid mater, space is known as a subarachnoid space. So the meaning of the word sub is below, right? So below arachnoid, it is subarachnoid space. And then you have this pia mater, and below the pia you might get a space, very thin space, that is the subpial space. So पहले क्या होता है? पहले है ड्यूरा मैटर. Above the dura, above मतलब ऊपर, that is epidural, epidural space. Below the dura, that is the subdural space. Above dura epidural, below dura subdural. ठीक है ना? ड्यूरा के बाद है तुम्हारा एरेक्नॉइड. एरेक्नॉइड के नीचे वाला स्पेस, बिलो द एरेक्नॉइड, इट इज सब एरेक्नॉइड स्पेस. ओके, सो पहले है ड्यूरा, अबोव ड्यूरा एपिड्यूरल, then subdural, then you have the arachnoid matter, then subarachnoid space, then you have the pia matter, and pia ke below you have a very thin space, that is a subpial space. All right. Okay, now this is important because ये recent में भी आया है. Okay, in 2017 also in the recent FMG also this came. So I want somebody to answer this. So a subarachnoid space, अभी हमने पढ़ा है. What do you mean by subarachnoid space? It is below the dura. Okay, it is below the dura. So this is the dura matter. Below the dura, it is a subarachnoid space. So what is the extension of the subarachnoid space? Subarachnoid space extends up to, they have given the option, lower border of L1, upper border of L1, upper border of S2, and lower border of S2. Anyone who wants to attempt this in the chat? Anyone who wants to answer this question? It's very like repeated question and a very important one. Subarachnoid space extends up to, किसी को आता है? Subarachnoid space extends up to. Anybody who wants to answer this question? subarachnoid space extends up to. So before that, let us see that the subarachnoid space and the dura mater as a whole, it extends up to the lower border of S2. So you can see this lower border of S2. Okay. You can see this lower border of S2 in this image. This is the with red mark I have marked, that is a lower border of S2. Okay. So both the subarachnoid space and the dura mater extends up to the lower border of S2. Okay, the lower border of S2. Spinal cord, another question which has been repeated. So spinal cord in adult extends up to the lower border of L1. This is in adult, lower border of L1. As you can see here, this is the conus medullaris of the spinal cord. Okay, you know that from here, the conus medullaris, the cone-like structure, is the conus medullaris. It extends up to your lower border of L1. Okay, and then in the newborn, it will extend up to the lower border of L3. Okay, in newborn, it extends up to lower border of L3. Okay, so if they ask you about the extension of the subarachnoid space, which they have asked this time, next time they might ask you about the extension of the dura mater. Okay, so both the answer is your lower border of your S2. Okay, for spinal cord in adult it is lower border of L1. For newborn it is lower border of the L3. The length of the spinal cord is 45 centimeter and the length of the vertebral column is 65 centimeter. So the spinal cord will end at the lower border of L1, the subarachnoid space and the dura will end at the lower border of the S2 where you will have the lumbar cistern. Okay. So the answer here will be, just now we have seen, so it will be the lower border of the S2. Okay. So this is the answer. The subarachnoid space extends up to the lower border of the S2. ठीक है? Lower border of S2. Any doubt in this? किसी को कोई doubt है? Okay. Now the termination of spinal cord in a newborn lies at the vertebral level of. Somebody answered this. अभी हमने एक image देखा है जिसमें I already told you about the adult extension of spinal cord. Now what is the extension of spinal cord in newborn? Out of all of this, okay, they have given the lower border of L1, S2, L2 and L3. So anybody in the chat who wants to answer this? A very easy question and repeated question. Anyone who wants to answer this? Termination of spinal cord in a newborn lies at the vertebral level of. Just now we have studied. Any answer? Where is the termination of spinal cord in newborn? Socho, in adult it is lower border of L1. What about the newborn? Termination of spinal cord is at the level of in the newborn. So the answer here will be your it will be whenever you see L3, it is the lower border of L3. Okay, it is the lower border of L3. Okay, it's the lower border of L3. Okay, termination of spinal cord in newborn is at the lower border of L3. Just now we have studied. Okay, it's at the lower border of L3. Now a little bit about the epidural anesthesia. So this came in the recent FMG question. So while administering the epidural anesthesia, which structure is not pierced by the needle? So they have given the option the supraspinous, the interspinous, the ligamentum flavum and the arachnoid mater. So anybody who can answer this while administering epidural anesthesia. So this is administered in the epidural space. Okay, so epidural space is above the dura mater. Okay, तो अगर कुछ भी चीज above the dura mater होगा तो will it pierce the arachnoid matter? Will it pierce the arachnoid matter? Anyone in the chat? If the epidural space is above the dura mater, will the anus needle reach the arachnoid matter? Anyone in the chat wants to answer this? So the answer here will be the arachnoid matter, alright, because epidural space is above the dura, it is not going to pierce the arachnoid matter. Okay, so to understand that, one more thing I want to explain here is that, so when the needle is going to pierce, right, first of all you will get the skin, okay, then superficial fascia, then you have a ligament here. This ligament is known as a supraspinous ligament. After that, it will also pierce another ligament, that is the interspinous ligament. And then this reddish structure, it is also going to pierce the ligamentum flavum. Ultimately, it is going to reach this space. It is going to reach this space, and this space is the epidural space, and then this is the dura mater. So it is outside the dura mater, it is not going to pierce the arachnoid matter, alright, it is not going to pierce the arachnoid matter. So you can see that this is the dura mater. So I am drawing the dura mater with blue color. So this is the dura mater. Okay, this is the dura mater and this is the arachnoid matter. ये हो गया तुम्हारा सब arachnoid space. This is the sub arachnoid space. And then this is the epidural space. So the needle is not piercing the dura even. Okay, so how can it pierce the arachnoid matter? So the answer here is arachnoid matter. So anything above the dura, is the epidural space. So the needle will enter the epidural space. It is not piercing the dura, it is not piercing the arachnoid. So the answer will be the arachnoid matter. So from outside to inside, whenever a needle enters, so you have to say there will be skin, the superficial fascia, a ligament, that is supraspinous, interspinous, ligamentum flavum. Then you will get epidural space. After epidural space, you will get dura mater. Then you will get then you will get the subdural space. After subdural space, you will get the arachnoid matter, and then you will get the subarachnoid space. Okay, so in the subarachnoid space, we do the lumbar puncture. Okay, lumbar puncture is done in the subarachnoid space. Yes, very good, Anand Kumar. He has answered. It is arachnoid matter. मैंने already बोला है epi. Whenever there is the word epidural, मतलब dura के बाहर. So आँख बंद करके the answer will be the arachnoid here. Okay, ये सब तो छोड़ ही दो. Epi मतलब dura के बाहर. It is not even going to pierce the dura. So ये arachnoid तो भूल ही जाओ. So the answer here is arachnoid matter. It's very very obvious. And they have asked, it is not pierced by. नॉट पियर्स बाय मतलब कौन सा पियर्स नहीं होता है. तो क्वेश्चन अच्छे से पढ़ लेना तुम लोग, ठीक है. ओके, नाउ देयर इज समथिंग अबाउट द एपिड्यूरल हेमाटोमा एंड सबड्यूरल हेमाटोमा. ओके, द एपिड्यूरल हेमाटोमा, okay, so there is a skull fracture. The blood will accumulate above the dura. Epidural hematoma, the blood will accumulate above the dura and it is going to push the dura away from the hematoma. So there will be pushing of the dura away from the hematoma. Okay? That is about epidural hematoma. What about subdural hematoma? The subdural hematoma is below the dura. Subdura matlab below the dura. So it is below the dura and the blood will expand like this. Okay, it is not going to push the dura. Okay, there will be no shifting of the dura. Okay, so dura is attached to the skull, so it cannot cross the falx cerebri and tentorium cerebri. Okay, so it is a slowly expanding one with a venous blood and torn vein, mostly because of the torn vein. And the epidural hematoma, as you have already known, it is due to the middle meningeal artery, middle meningeal vessel, mostly at the region of the terion, wherever there will be a trauma at a blow at the terion, because it is the weakest point. So the middle meningeal artery, which is a branch of maxillary artery, will be damaged, leading to accumulation of blood in the epidural space. Okay, so anything which comes as epidura matlab above dura, subdura matlab below dura. Okay. Okay, now let us come to the dural folds. What are the dural folds? So, dural folds are of the following types. You have a dural fold that is known as falx cerebri. Now, the word cerebri, so it will be in the, if you have to orient yourself with this diagram, okay? If you have to orient yourself with this diagram, let me show with a different color. Okay, so you know that this is frontal pole, this is the frontal part, and this is the occipital part. Okay, so the dural fold here, this dural fold, okay, which is attached to the frontal crest, that is known as your falx cerebri. Sorry, this is the frontal part, the dural fold attached here, that is the falx cerebri. Okay, this is the falx cerebri. This is the frontal, I am wrong, this is the frontal and this is the occipital pole. Okay, so this is the falx cerebri. Okay, so if you remove the cranium, the dura is attached like this, okay, through the longitudinal median suture. Okay, so this entire dural fold which is attached here, this is known as the falx cerebri. Okay, falx cerebri. Okay. So this entire part is the falx cerebri. Okay, then you have one, this is the frontal part and this is the occipital part. You have another fold of dura, that is the falx cerebelli. Falx cerebelli. Okay, now falx cerebelli is in the posterior cerebellar notch. Okay, and the falx cerebri is in the median longitudinal fissure. So this is the median longitudinal fissure, which also corresponds to your superior sagittal sinus, also the sagittal suture. So the fold of dura attached here is your the falx cerebri. Okay, and the posteriorly the fold of dura attached is the falx cerebelli, cerebellum, piche. Okay, then you have another layer of dura, that is a tentorium cerebelli. It is in the transverse fissure. Okay, so this part is the tentorium cerebelli. This is a transverse fissure. So this is the tentorium cerebelli. And then you have another that is known as the diaphragma sella, which is in the interpeduncular fossa. Okay, it is in the interpeduncular fossa. Interpeduncular fossa is the location of your circle of Willis. So if they ask you about the circle of Willis location, so it is the location is interpeduncular fossa or interpeduncular cistern. Okay, so these are the dural folds. So you have the one which is going through the longitudinal fissure, and this fold is your falx cerebri. Then on the back side, on the posterior cerebellar notch, you have falx cerebelli. On the transverse fissure, you have the tentorium cerebelli, and in the interpeduncular fossa, where you will have the circle of Willis, the optic chiasma, there you will have the diaphragma sella. Okay, so those are about the dural folds. So as you can see in this section as well, so see here, you will have the falx cerebri, the falx, this is the frontal part, okay, this is the occipital part. So this entire dural fold here in the median longitudinal fissure, this is the falx cerebri. Okay, then you have the falx cerebelli, that is on the posterior part, the falx cerebelli on the posterior part. Then on the transverse you have the tentorium cerebelli. Okay, on the transverse sinus you have the tentorium cerebelli, and then you will also have the diaphragma sella in the interpeduncular fossa. Okay, so those are about the dural folds. Now Let us attempt this. बहुत easy है. Leptomeninges is formed by anybody in the chat. अभी हमने पढ़ा है about meninges. So there is pachymeninx and there is leptomeninx. So leptomeninx is formed by, they have given dura and arachnoid, arachnoid and pia, dura and pia, dura, arachnoid and pia. Anybody from the chat? I want this answer first. Leptomeninges is formed by. Anyone who wants to attempt this? बहुत ही easy question है, like the easiest of all the questions which has been repeated in FMG. Leptomeninges is formed by. Anybody in the chat who wants to answer this? Leptomeninges is formed by. बहुत easy question है. Come on, somebody should answer this. Try to at least attempt to answer. Leptomeninges किसको बोलते हैं? पैकीमेनिंग्स किसको बोलते हैं? So the answer will be, you know that the leptomeninges is formed by your arachnoid and pia matter. Okay, the answer is arachnoid and pia matter. Isn't it obvious? Okay, हमने अभी पढ़ा है. We have seen the differentiation. Can't you see that the dura is known as the pachymeninx, derived from the mesoderm, and the arachnoid and the pia is derived from the neural crest. It is known as the leptomeninges. Okay, so the answer is sorry, the arachnoid and the pia. The answer will be the pia and the arachnoid. बहुत ही easy question था. Okay, I wanted someone to answer this. It was so easy. Okay, so it is your pia and arachnoid. Okay, pia and arachnoid. It is so easy. Okay, now let us proceed to the dural venous sinuses. Okay, so dural venous sinuses are unpaired and paired sinuses. Okay, they are paired and unpaired. So what are the unpaired sinus? What are the single sinus? So the one which is on the superior sagittal suture, this is the superior sagittal sinus, that is the unpaired sinus. The inferior sagittal sinus, so you have the superior sagittal sinus, that is unpaired sinus. Okay, the inferior sagittal sinus is also unpaired sinus. Then the straight sinus, very important. A recent question has been asked on the straight sinus. The straight sinus is also unpaired sinus. The occipital sinus, intercavernous, and the basilar venous plexus, all are your unpaired sinus. Now if they ask about the paired sinuses, you have the cavernous sinus, the superior petrosal, inferior petrosal, the transverse, sigmoid, sphenoparietal, and the petrosquamous. So try to remember that the straight sinus is unpaired sinus and the transverse sinus is paired sinus. So sometimes they might confuse you. Okay, the transverse, sigmoid, all these are paired sinuses and the straight sinus is your unpaired sinus. Okay. So as you can see here, these are the cavernous sinuses. Okay, these are the cavernous sinuses, and this is a straight sinus. It is unpaired sinus. And here also you can see that here you will have the straight sinus. Okay, so this is the cavernous, this is the straight sinus. Then you also have the superior sagittal sinus going from above, the transverse sinuses. Okay, and the basilar venous plexus here. So these are about all the paired and unpaired sinuses, right? Now I want to see everyone to see this image once. पहले ये image देख लो and then we'll attempt a question on this. For 1 second you observe the image, what you can see here. So in this part, just concentrate. This part, this area is the straight sinus. Okay, and this is the cut section of the superior sagittal sinus because it is going up like this. So they have just cut the brain like this. So just you can see the starting of the superior sagittal sinus, and the meeting point of all the sinuses is here, that is the confluence. Okay, so this is the straight sinus as you can see in this image. Okay, ये है आपका transverse sinus that is running transversely. Okay, this is a transverse sinus. Okay, this is a transverse sinus, and then the one which takes a bend towards the jugular foramen, this one is known as the sigmoid sinus. ठीक है? So this is a sigmoid sinus, this is a straight sinus, the cut section of the superior sagittal confluence, and this is the transverse sinus, and you have the cavernous sinus on both sides. This is the cavernous sinus, here also we'll have the cavernous sinus, and this is the basilovenous plexus. So those are about the sinuses. This is the going through the petrous part of the bone, that is the superior petrosal sinus. Okay, you just need to orient yourself with the sinuses in the cut section so that you can attempt some questions which has been on the CT scan. Okay, the non-contrast CT scan, they have asked many questions on the sinuses. So if you get oriented with this image, then you can answer the questions there. All right. So you can see here this one SS, that is the straight sinus, and this is the cut section of the superior sagittal sinus. Triple S, that is the superior sagittal sinus, and anteriorly you have the cuts. This is the straight sinus. Okay, you can also see the straight sinus here. Okay, this is the straight sinus. The arrow they have marked in the lateral view. So that is the sagittal view. You can see the straight sinus, and in the axial view also you can see the straight sinus anteriorly, and here you have the cut section of the superior sagittal sinus. Okay. Okay. Now let us study the structures in the lateral wall of the cavernous sinus. So lateral wall में क्या क्या structures है? So you know that this is the cavernous sinus. So you know that this is the cavernous sinus, and this part is the lateral wall. Okay, this is the lateral wall, this is the medial aspect. Okay, so in the lateral wall, what are the structures present? In the lateral wall, क्या structures है? Mostly you have to remember certain mnemonics, or you can just remember as a nerve also. So what are the structures in the lateral wall? As you can see the structures, okay, you can see many nerves in the lateral wall. Okay, you can see many nerves here. You can see oculomotor, trochlear, ophthalmic, maxillary. Okay, so those are the structures in the lateral wall. So you have the oculomotor, the third cranial nerve, the trochlear, the fourth, the ophthalmic, the first branch of the fifth cranial nerve, the maxillary, the V2, and the postganglionic sympathetic fibers. These are the structures present on the lateral wall of the cavernous sinus, and the structures passing through the cavernous sinus. So you can see certain structures like the internal carotid artery and the abducens nerves. These are passing the cavernous sinus. Okay, so the internal carotid arteries are, as it is large arteries, are always surrounded by the sympathetic plexus. Okay, so you have the internal carotid and the abducens passing through the cavernous sinus, and the structures related on the lateral wall are your the third, fourth, fifth, and postganglionic sympathetic fibers. Among the fifth, you have the V1 and V2. So these are the structures present in the lateral wall of the cavernous sinus. Okay, and then they give many tributaries like the superior ophthalmic vein, the inferior, the central vein of retina. From the meninges, you have the sphenoparietal, anterior trunk or medial meningeal vein, and from the brain, you have the superior medial cerebral and the inferior cerebral veins. These are the tributaries of the cavernous sinus, and certain communications, which I am not going to discuss in details. You can just go through the note. But what is important is that the nerve passing through the cavernous sinus. So I want anybody to answer this. What is a nerve passing through the cavernous sinus? They have not asked about passing through the lateral wall. They are asking about which is just passing through the cavernous sinus. So anybody in the chat wants to answer this? The nerve passing through the cavernous sinus. So the nerve passing through the cavernous sinus, anybody can answer this? Any answer? The nerve passing through the cavernous sinus. Anyone who wants to attempt this at least? Just now we have discussed. Which is a nerve passing through the cavernous sinus. So the answer will be abducens nerve. Okay, so we have already studied that internal carotid artery and the abducens nerve will pass through the cavernous sinus. ठीक है, so the nerve passing through the cavernous sinus will be the abducens nerve. अभी अभी हम लोग ने पढ़ा था इधर. Okay, the nerve which is passing through the nerve passing through the cavernous sinus. So among this entire thing, the internal carotid artery, sympathetic plexus surrounding it, and the abducens nerve. So the answer there will be the abducens nerve. Okay, so the answer here will be the abducens nerve. The abducens nerve. Okay. Okay. Name the dural venous sinus marked in the radiograph. So anybody who can name this, just now we have studied the dural venous sinus marked in the radiograph. So they have given the straight sinus, the superior sagittal, inferior sagittal, and the confluence of the sinus. So just observe this scan and try to answer this. Anybody? It's very easy. Just now we have studied about all the sinuses. So what is the mark dural sinus in the radiograph? Anybody who wants to answer this? Anyone who wants to answer this? The marked area in the radiograph. Which of the following is the dural venous sinuses? तो बहुत easy है. अभी हम लोग ने एक image देखा था. I told you to see the image properly. So on the basis of that image the question is set. So ये 2022 में आया था question. Anyone who wants to attempt this? Any answer? Any guesses? देख के क्या लग रहा है? So the answer is so obvious, isn't it? This structure here is the straight sinus. So the answer, the answer is straight sinus. Okay, the answer will be straight sinus. अभी हम लोग ने एक image दिखा. This is the straight sinus. Okay, here you will have the superior sagittal sinus cut portion and confluence will be somewhere here. But this part, this area is the straight sinus. बहुत ही easy question था ये. This is a straight sinus. Okay. So you can see in this image again. Okay. Just you can see the image. So as you can see, this is a straight sinus and this is a straight sinus. Okay. This is the cut section of the superior sagittal sinus and this part is the straight sinus. Okay. So this is a scan of the straight sinus. This might be repeated again. Okay. So you just go through the scan again. Okay. Now the cavernous sinus, this is also a question, the cavernous which has been repeated in FMGE. So it is a collection of venous sinus on either side of pituitary. Which of the following does not pass through the lateral wall of cavernous sinus? So any answer? Does not pass through the lateral wall. They have given does not pass through the lateral wall of the cavernous sinus. Any guesses? Which of the following does not pass through the lateral wall of the cavernous sinus? It's very easy. Abhi we have attempted a similar question. Anyone who wants to answer this? lateral wall of the cavernous sinus. We have studied the nerves. Okay, we have studied 3, 4. Okay, V1, V2, and postganglionic sympathetic fibers. And the internal carotid artery is passing through the cavernous sinus, just passing. Okay, it is entering the cavernous sinus, but not through the lateral wall. So the answer is internal carotid artery. Okay, so the answer will be internal carotid artery. Very, very easy question. Now let us come to the cerebral hemisphere. Okay, so we have finally entered the brain. So पहले हम लोग ने क्या पढ़ा? We have studied the cranium. Okay, we have studied the cranium. In the cranium, we have studied about a therion, asterion, inion. Okay, we have studied about a glabella, the nasian, the rhinian, the gnathian. Okay, after we have removed the calvaria, the bony structure, we got the meninges. Okay, so we know that we had 3 meninges. One is the dura, next is the arachnoid, and next is the pia mater. Now the dura mater is derived from the mesoderm and it is known as pachymenings. It is thick and fibrous. The arachnoid and the pia mater are very, very thin and they are known as leptomeninges. Now this is the dura. Above the dura, the space is known as the epidural space. Epidural, above dura. Below dura, the space is the subdural space. Okay, after subdural space you have the arachnoid. So arachnoid के नीचे का space को हम बोलेंगे subarachnoid space. Anything which has the word sub is below. Okay, and then we had pia and then we had the brain. Now in the brain you had the poles. Okay, so you had a frontal pole. Okay, in the front you had a frontal pole. On the temporal lobe you have a temporal pole. On the back you had a occipital pole. So these are the poles of the cerebral hemisphere, the brain. Okay. Okay. So similarly you can see this is the frontal pole. Okay, this is the frontal pole, and then this is the occipital pole. You have a long median fissure. This is the longitudinal cerebral fissure, and you have a sulcus here which divides the entire brain into the frontal part which is motor and the posterior part which is somatosensory. Okay, so this is the deepest sulcus which is known as the central sulcus of Rolando. Okay, central sulcus of Rolando. Here also in the lateral view you can say this is the frontal pole, this is the occipital pole, and this is the temporal pole. Okay. Okay. Now what are the surfaces? We have a superolateral surface. Superolateral surface. So this is the superolateral surface. If you cut the brain into halves and if you take out and see the medial portion, that is the medial surface, as you can see here. And if you can hold the brain and see from the inferior aspect, if you see from below, that is the inferior surface. So the inferior surface is divided again into the anterior part which has the orbital part, that is the orbital part, and the posterior part that is known as the tentorial part. Okay, so the posterior part is the tentorial part and the anterior part is the orbital part. Okay, so these are the surfaces of the brain. Okay. Okay. So the main cerebral sulci. So हम लोग थोड़ा main sulci पढ़ेंगे. So one is the lateral sulcus of Sylvius. So you have a lateral sulcus here. Okay, just above the temporal lobe you can see the lateral sulcus of Sylvius. Then you have the central sulcus of Rolando. I have already told you the central sulcus is dividing the entire brain into anterior motor part and the posterior somatosensory part. So you had a central sulcus of Rolando, and then you have a calcarine sulcus on the lower part. You will see a calcarine sulcus and a parieto-occipital sulcus. Okay, you have a parieto-occipital sulcus. So these are the major sulcuses. All right. Now let us study a little bit about the Sylvian fissure and the Sylvian sulcus. Okay, the lateral sulcus. Why? Lateral sulcus of Sylvius or the Sylvian fissure. Okay, now it is known as the lateral sulcus. Now as shown here, this is the Sylvian fissure. Let me show with a different laser pointer. Okay, so you can see here, this is a Sylvian fissure. Okay, this is the Sylvian fissure. In this image you can see this is the Sylvian fissure. Okay, it separates the frontal, this is the frontal lobe, and the parietal lobe. Okay, it is the parietal lobe, this is the frontal lobe from the temporal lobe. Okay, this fissure is going to separate the three lobes, that is the frontal lobe, the parietal lobe, and the temporal lobe. So that fissure is known as the Sylvian fissure. Now it has three stems. One you can remember by the three fingers. Okay, the one which is going horizontally, this is known as the anterior horizontal, and this one is anterior ascending and posterior. So I always try to remember with my fingers. So it has three rami. Okay, the one which is going anteriorly is the anterior horizontal, the one which is going above is the anterior ascending, and my thumb is the posterior rami. Now these three rami diverge as a point. Okay, this point is known as a Sylvian point. Okay, now there is some significance of the Sylvian point, that's why I am teaching this. Okay, so let us see here in this image. As you can see, okay, so you can see that this is the anterior horizontal. Okay, I am drawing with a red color. As you can see here, this is the anterior horizontal. Okay, this arrow you can see. So this is the anterior horizontal. Okay, that is the anterior horizontal. Then with the green color I am showing you, this is the anterior ascending rami, anterior ascending rami. Okay, and with the blue color, this is the posterior stem. Okay, the posterior stem. This is the posterior stem. Okay, now as I have shown you, this is the anterior ascending, this is the ascending, anterior horizontal. So this is the anterior horizontal, this is the ascending, anterior ascending, and this is the posterior. So below the anterior horizontal, the part is known as the orbital part. So it is known as pars orbitalis. Okay, below the anterior horizontal, the part is the orbital part, and it is known as a pars orbitalis. Now between the anterior horizontal and the ascending, you can see a triangle formed. Okay, so this triangular area is known as pars triangularis. Okay, and behind the anterior ascending and the posterior, this is opercularis. Okay, so if you can see here, below this horizontal part, this part is the pars orbitalis, the one I have just shaded. That is the pars orbitalis. Then this triangular area between the horizontal and the ascending is the pars triangularis, and this part is the pars opercularis. Okay, similarly in this image you can see this is the pars orbitalis. Okay, number 3, this is the pars orbitalis, this is the pars triangularis, number 2, and number 1 is the pars opercularis. Okay, pars opercularis. So you can see here, this is the anterior horizontal, this is the anterior horizontal stem. Below that, this part is the pars orbitalis. Between the horizontal and the ascending, this is a triangular area, this is the pars triangularis, and behind this is the pars opercularis. Okay, so just imagine with your three fingers, so you have the anterior horizontal, anterior ascending, and the posterior. Below the anterior horizontal, you have the orbitalis. Then between the horizontal and the ascending, you have the triangularis, and behind that you had opercularis. Now there is a question that Sylvian fissure separates which of the following. So they have given the temporal lobe from the occipital, the temporal from the frontoparietal, temporal from the opposite frontal, and temporal from the cerebellum. So anybody who wants to attempt this question, just now we have studied about the Sylvian fissure. Anyone who wants to attempt in the chart, in the chat, anybody who wants to attempt this question, it's very easy. Just read the question once and try to attempt it. Anybody who wants to attempt this question. सिल्वियन फिशर किस किस क्या कौन सा लोब को सेपरेट करता है? Any answers? Okay, so Sylvian fissure, as I already told you, Sylvian fissure is going to separate the temporal lobe from the frontoparietal areas. Okay, it is going to separate the temporal lobe. This is the temporal lobe. Okay, and this is the parietal lobe, and this is the frontal lobe. Okay, it is going to separate the three lobes as we have already studied. The Sylvian fissure is going to separate the three lobes, that is the frontal lobe, the parietal lobe and the temporal lobe. So it is going to separate the temporal lobe from the frontoparietal area. So the answer is B. Okay. Next, let us study a little bit about the sulci and gyri. Okay, so in the superolateral surface, okay, in the superolateral surface, you can see certain sulci and gyri. Okay, so the one which is the largest one, okay, the one which is the largest one, this one is the central sulcus. This is the central sulcus. Okay, so you can see the central sulcus in this image as well. This is the central sulcus. As I told you, the central sulcus is going to divide the entire brain into the anterior motor and the posterior somatosensory area. Okay, we have anterior motor and a posterior somatosensory area. So this area will be your motor and this area will be your somatosensory. Okay, now from in front of the central sulcus, you have a gyrus. Okay, you have a gyrus. So just imagine hills and plateau. If there is a hill, that is the gyrus, and if there is a plateau, that is the sulcus. So what do you mean by the sulcus? It is the plateau. And what do you mean by the gyrus? That is the hills. So hills and plateau. सेंट्रल सल्कस के आगे जो हिल है उसको हम बोलेंगे द प्री सेंट्रल गाइरस. इट इज नोन एज द प्री सेंट्रल गाइरस. Okay, now from the precentral gyrus you have again two sulcus, that is a superior frontal and the inferior frontal sulcus, which is going to divide this entire area into superior frontal, middle frontal and inferior frontal gyrus. So let us see again in this image. Okay, so this is the central sulcus, okay, and this is the precentral gyrus. Now you have the superior frontal gyrus, the middle frontal gyrus and the inferior frontal gyrus as well in the frontal lobe. Similarly, if this is the central sulcus, उसके पीछे जो gyrus है, that is known as the post-central gyrus. As you can see here, it is known as the post-central gyrus. Okay, and उधर में से you have a superior parietal lobule and inferior parietal lobule separated by a intraparietal sulcus. Okay, so there is a sulcus here. There is a sulcus here which is dividing into the superior parietal lobule and inferior parietal lobule. In parietal lobe, we will see it as lobule. Okay, so in the frontal part, you have the superior frontal gyrus, the middle frontal gyrus, and the inferior frontal gyrus, the precentral gyrus. In the posterior to the central sulcus, you have the postcentral gyrus, the superior parietal lobule, and the inferior parietal lobule. Now in the temporal, now this is a Sylvian fissure. As you know, this lateral sulcus is the Sylvian fissure. So below that you have a superior temporal sulcus and you have a superior temporal sulcus and an inferior temporal sulcus, dividing this entire temporal lobe into superior temporal gyrus, the middle temporal gyrus and the inferior temporal gyrus. This is in the temporal lobe. And in the occipital lobe, you will see here, okay, this is the occipital lobe. So you can see here, this is the occipital lobe. You have a sulcus here that is known as a lunate sulcus. Okay, a lunate sulcus. So you have a superior occipital gyrus and a inferior occipital gyrus. Okay, inferior occipital gyrus. So those are the sulci and gyruses in the superolateral surfaces of the brain. Okay, these are the sulci and gyri in the superolateral surfaces of the brain. Let us see on the medial surface. What are the sulci and gyri in the medial surface? Okay. So as you can see, this is the corpus callosum, right? This is the largest commissural fiber. This is the corpus callosum. First of all, you orient yourself. Now you know that this is the splenium. Splenium is in the posterior part. So this is the occipital lobe and this is the frontal lobe. Okay? And the genu is in the anterior part. So this is the corpus callosum. Now corpus callosum is lodged in a sulcus and that sulcus is known as the callosal sulcus. Okay, the corpus callosum is lodged in a sulcus and that sulcus is known as your callosal sulcus. Okay, now this sulcus is the callosal sulcus. The corpus callosum कौन से sulcus में रहता है? It remains in the callosal sulcus. Above the callosal sulcus, this gyrus is known as the cingulate gyrus. Okay, cingulate gyrus. So you have the cingulate gyrus above the callosal sulcus, and above the cingulate gyrus you have another sulcus. Okay, this entire is a cingulate gyrus. Okay, and then above that you have another sulcus, that is a cingulate sulcus. Okay, so first of all, you can see the corpus callosum. It is lodged in the callosal sulcus. After that you have the cingulate gyrus and then you have the cingulate sulcus. Okay, now the cingulate sulcus, it is sending a tweak on the upper part. Okay, it is sending a tweak on the upper part and it is dividing this area into paracentral lobule. Okay, so this area is known as the paracentral lobule. Okay, this is the paracentral lobule, and behind this tweak you have the precuneus. Okay, just let me show you with the laser. So behind this tweak you have the precuneus, and then you have a sulcus that is known as the parieto-occipital sulcus, and behind the parieto-occipital sulcus you have the cuneus. ओके उसके बाद तुम्हारा कैल्कराइन सल्कस आएगा, उसके बाद जो गाइरस है दैट इज नोन एज द लिंगुअल गाइरस. ठीक है, so you have the corpus callosum. Okay, this is the corpus callosum. If you go from anterior, this is the G is for genu, then this is for body. Okay, and this is splenium. ठीक है, and आगे में इधर में होगा तुम्हारा rostrum. Okay, we'll have the rostrum, and this is the fornix. Fx is the fornix. Okay, now this is lodged in the callosal sulcus. Okay, above this you have a gyrus, that is the cingulate gyrus, and above the cingulate gyrus you have a sulcus, that is the cingulate sulcus. Now it is sending the cingulate sulcus, as you can see, it is sending a tweak above, right? It is sending a tweak above. So this area is known as the paracentral lobule. Okay, this is the paracentral lobule. And then you have an area just in front of the parieto-occipital sulcus. This area is known as the precuneus. Area behind the parieto-occipital sulcus is the cuneus. Then you will get a calcarine sulcus, and area behind the calcarine sulcus is known as the lingual gyrus. Okay, so these are the sulci and gyri present in the medial surfaces. Okay, so you can see this image, the cut section. Okay, again I want to show the cut section. So as you can see here, this is the callosal sulcus. Okay, this is the callosal sulcus which is lodging the corpus callosum. Okay, this is the callosal sulcus. If I have to show with a pen color, I will show it. So with this blue color, as you can see, this is the callosal sulcus which is lodging the corpus callosum. ठीक है, so corpus callosum, this is the genu. It is the frontal part. Genu is in the front. Okay, genu, and then you have below you have the rostrum. Genu is the band of the corpus callosum. Okay, and this is the body of the corpus callosum, and the last part is known as the splenium. Okay, so this is the largest commissural fiber. Above the callosal sulcus, you have a gyrus, and that gyrus is known as the cingulate gyrus. And above that, you will have a sulcus that is known as the cingulate sulcus. Okay, now the cingulate sulcus is sending a tweak above. I told you it is sending a tweak above. Now this around the lobule around this tweak is known as the paracentral lobule. This lobule is important because it is responsible for micturition and defecation. Yes, very right. Somebody has written genu, body, rostrum, splenium. You just need to remember that splenium S alphabetically पीछे होता है ना, और G आगे होता है. तो genu is anteriorly, splenium is posteriorly. तो पहले you have a thin plate that is the rostrum, then you have a band that is the genu, then you will have a body, and then you have a splenium, the S-shaped structure on the posterior part. On the posterior part is the splenium. तो S पीछे होता है, G आगे होता है. तो rostrum, genu, body and splenium. Okay. Okay, very good. Somebody has written about the Papage circuit as well. ठीक है. Now, okay. Now you know about the cingulate gyrus. Now, अभी हम लोग Papage discuss नहीं करेंगे. We are just studying about the location because sometimes you get a image based question where they will give a arrow in the cingulate gyrus. ठीक है. They will give an arrow on the cingulate gyrus and ask question. So this is the cingulate gyrus, and what is important about that, from the cingulate gyrus there is a twig going up, okay, and around the area around this twig is known as a paracentral lobule. The paracentral lobule, it is very important lobule, the paracentral lobule, because it is the lobule responsible for micturition and defecation. Any injury in the paracentral lobule will lead to your difficulty in micturition and defecation and your paralysis on the contralateral side of the limb, that is paraplegia. Okay, now this is a paracentral lobule. उसके पीछे जो gyrus होगा उसको बोलेंगे हम precuneus. This is the precuneus. Then you have a parieto-occipital sulcus. उसके पीछे जो होगा gyrus उसको बोलेंगे हम cuneus. Then you have a calcarine sulcus, as you can see here, calcarine, and उसके पीछे ये जो gyrus है इसको बोलेंगे हम lingual gyrus. Okay, lingual gyrus. Now these are the thalamic connections. Okay, these are the thalamic connections. Rostrum, as you can see, rostrum के just नीचे you will have a thin plate. Okay, a thin plate that is known as the lamina terminalis. Lamina terminalis. उसके नीचे रहेगा enterocommissure. Okay, then this area will be your hypothalamus, and these bodies are your mammillary body. This is a midbrain. ये आ गया corpora quadrigemina, and this is the posterior commissure. I'm just telling you to orient yourself because sometimes they give a arrow on a scan and they ask you what is this. Okay, so just orient in this cadaveric image so that you get an idea about that. ठीक है? So this is just an image of the all the gyruses and sulcuses. ठीक है? Okay, now let us come to the inferior surface. Now as I told you, if you remove the brain and if you see from inferior part, then you have an anterior orbital part and a posterior tentorial part. Now what are the gyruses and the sulcuses in the orbital part? So let us start. You have a thing that is the olfactory bulb. Okay, let me show you here. Okay, you have an olfactory bulb here. The one I am drawing with the blue color, that is the olfactory bulb. Okay, just see here, the olfactory bulb. Okay, the olfactory bulb के जो medially जो gyrus होगा, the medial gyrus, the gyrus which is medial to the olfactory bulb is known as the gyri recti. Okay, it is known as the gyri recti. Okay, so first we have the olfactory bulb. The gyrus medial to the olfactory bulb is the gyri recti. Now if you go to lateral side, you will have a H-shaped sulcus. You will have a H-shaped sulcus which is dividing the entire orbital part into the anterior orbital gyri, the posterior orbital gyri, okay, the medial orbital gyri and the lateral orbital gyri. Okay, so in the orbital part, first of all you have a orbital tract. उसके medially, orbital tract मतलब orbital bulb and tract, उसके medially you had the gyri recti and उसके laterally you will have a H-shaped sulcus, and that is dividing the entire orbital area into anterior orbital gyri, posterior orbital gyri, medial orbital gyri, and the lateral orbital gyri. Okay, so that is about the sulcite gyri on the inferior surface, on the orbital surface. Let us go to the tentorial surface. Now, sometimes they ask you about the collateral sulcus. The collateral sulcus. Okay, so the collateral sulcus. This is the collateral sulcus. This is the collateral sulcus. Okay, so the medial most sulcus on the tentorial surface is the collateral sulcus, and the lateral most sulcus is known as the occipitotemporal sulcus. The lateral most sulcus is known as the occipitotemporal sulcus. ये collateral sulcus आगे जाके it takes a upturn here. Okay, it takes a upturn here. This anterior part of the collateral sulcus is the rhinal sulcus, and this upturn is known as your uncus. Uncus. Okay, so sometimes they might give an arrow in the uncus and ask you what is this area, what is this gyrus. So first of all, you have to see that you have to orient yourself that it is the which part of the brain. So you know that this is inferior part of the brain and this is the tentorial surface. So first you see the collateral sulcus. You trace the collateral sulcus. Anteriorly you will get a rhinal sulcus, and this is going to take an upturn here, and then you get a gyrus here that is known as the uncus. Okay, you get an uncus here. Okay, and then you have an occipitotemporal sulcus as well. Okay, you have an occipitotemporal sulcus as well. So it is dividing into the medial occipitotemporal gyrus and the lateral occipitotemporal gyrus. Okay, the medial occipitotemporal gyrus and the lateral occipitotemporal gyrus. Okay, now this gyrus, the upper part is known as uncus. This gyrus is known as your parahippocampal gyrus. It is known as the parahippocampal gyrus. Okay, this gyrus on the medial aspect, the parahippocampal gyrus anterior most part is taking an upturn, that is the uncus, and this gyrus is the parahippocampal gyrus. So this is the parahippocampal gyrus, okay, and this is the uncus, and this is the collateral sulcus. So at least you should know about the structures present on the tentorial surface. Alright. So already I told you about the lobes, the frontal, occipital, the temporal, the parietal lobes, okay, and about the sylvian fissure. Now we are going to study about the functional areas, okay, of the cerebral cortex. So anybody has any doubt? Anybody has any doubt in the functional areas? Any doubt in the functional areas? Okay, so this functional areas we are going to cover in the next neuroanatomy part, okay, in the part 2. But let us just try to answer this question. I am going to take the functional areas and all other things, all the FACRs, okay. So I hope that everybody attempts my next session. Okay, it is very important and it's little bit complicated. So if you see all these images, you will understand well. So I have touched all the repeated questions in this neuroanatomy part in this slide. Okay, so try to attempt the next session, that is the functional areas and other remaining part. Okay, so I want somebody to answer this. Foramen transversarium is found at, anybody can answer this question. Foramen transversarium ये कहाँ मिलता है? एंटीरियर क्रेनियल फोसा, पोस्टीरियर क्रेनियल फोसा, मिडिल क्रेनियल फोसा और सर्वाइकल वर्टिब्रा. Anybody who wants to answer this? Foramen transversarium. You have heard about it. So it is found in the cervical vertebra. Okay. So you can see that this is the foramen transversarium, which is found in the cervical vertebra. Okay, this is the foramen transversarium. Okay. So with this I end today's session. Okay, I hope you understood well whatever I have taught, and next session will be on the functional areas and all the aphaesias, the Broca's, Wernicke's, global conduction aphaesias, all the aphaesias. So I want you to attempt the next session, okay, so that you understand the functional areas and you can attempt the question. Every year a question is to come on the functional areas. Okay, so with this I end today's topic. I hope you understand well. Any question you can ask me in the chat. Okay, the chat is open, and the comment section you can ask any question regarding today's session. I will answer it. I will try to answer. Any doubt in the neuroanat part, you can ask me in the comment section. I am there to answer in the comment section, so I will be answering. If you have any question, just ask in the comment section. Any MCQs, I am definitely there to answer. So next session will be on the functional areas, so I hope everybody attempts that. Okay, we'll go into the CT scans, the MRI scans, and all of the parts of the brain, so that you don't get confused. Okay, next session will be all on the all normal scans of the brain, how to identify the brain, the parts of the brain, the internal capsule, the basal ganglia. Okay, the caudate nucleus, how to identify in the CT scans, in the MRI, all that I will go through in the next session, and I want everybody to attempt that session. Okay, with that I end today's session, and any question just attempt in the, just ask in the comment. Okay, we are going to answer it. Okay, with that I end today's session. Thank you very much.